Today, the doctor's is all new.
I can just pull this away from my body.
She lost half her body weight and was left with pounds of excess skin. Now,
nobody else on the planet is doing what we're doing today.
5 surgeons, 8 hours.
One of the most complex surgeries that we've ever done.
We lifted her back, buttocks, thighs, abdomen, and her breasts.
The stunning results. Then they're calling it the magic pill. But can it really help you lose weight?
It could be the weight loss cure.
And
it's a procedure that can be potentially life-saving.
We're going to do that right here in the procedure room.
Right here, live.
Coming up right now on The Doctors, where MD meets TV.
Doctor, give me the news.
Taking you inside one of the most complex surgeries that we've ever done. It took 8 hours, 5 surgeons, and a whole lot of care to help Amanda. At her heaviest, she weighed close to 400 pounds. She was so frustrated that she opted for gastric bypass surgery, and as you can see, it left her 180 pounds thinner and certainly healthier, but with pounds of extra hanging, loose skin that had nowhere to go. It's absolutely fascinating. Drew, tell us.
It truly was an epic marathon surgery. 5 surgeons, over 8 hours. We actually lifted her back, her buttocks, her thighs, her abdomen, and her breasts. To put this into perspective, we removed 1 square yard of skin. That comes out to 15 pounds of fat that was removed. And I have my colleagues in the procedure room now, Dr. Hurwitz, Dr. Brenner, two members of the Dream Team, just taking a look at Amanda before she comes out here.
Unbelievable.
Wow, that is amazing.
This was truly epic stuff, and
it sounds like it.
And 5 surgeons actually got along.
That's a first.
It is a first.
We're going to take everyone at home inside the operating room for Amanda's groundbreaking surgery and show you how dramatic her results are later in the show. But first, I want to talk about a less drastic option for women who want weight loss. It could be the weight loss cure, if it's true, the miracle fat-burning pill. So scientists have isolated this chemical cousin of resveratrol, which is found in red wine, powerful antioxidant that may preferentially burn fat.
And guess where this study comes from? France. Yeah. I think it's just another ploy to get you to drink red wine. So for the moment, I'm going to have my glass of Pinot Noir or Merlot, and I'm not sure when this pill is coming, but...
Oh, it's going to be a while. It's at least 7 years away.
And you're not going to be able to get the benefit from drinking wine, okay? So don't go home and chug back a full bottle of wine.
Don't listen to Dr.
Because this pill, it's super concentrated.
Right.
And it stimulates the enzymes in the body that turn to burn fat, kind of fools your body into a fat-burning state.
Well, that's the premise, that you can still eat cheeseburgers and everything and still lose weight, which...
Wouldn't that be great?
Yeah, exercise has the same effect.
It's a lot harder, but it's, in the long run, it's better, because who knows, even if it's weight loss, cholesterol still may have deleterious effects on the heart.
Sure, yeah. It's exciting. It's an exciting study, and I think, maybe a decade down the road, we'll turn to this as an adjunct to exercise.
At least it's opening the doors of knowledge in terms of how the body works. One side effect of this pill, in mice at least, was they became couch potatoes. Oh, really? They had a less desire for activity. Even though they were burning fat, they didn't feel like moving. So
it's also the couch potato pill.
Yeah.
It'll be interesting to see what comes of this.
Yeah, sure.
Well, the lengths that some people will go to lose weight or look younger are absolutely horrifying to me. I don't know if you saw this in the news, but there is a woman, she became so obsessed with plastic surgery as well as facial injections that when she ran out of silicone, she injected her face with cooking oil. And the results are so disfiguring that I personally am disturbed by this because
it's tragic.
It's tragic. And why does this happen, Drew? Is this a true obsession?
This poor woman, nobody picked up on the fact that she had what's called body dysmorphic syndrome, that she didn't have a realistic appreciation of how she really looked. So she kept going. She started with silicone injections.
But they gave her silicone to go home with, and syringes.
The doctor that finally said, you know, I'm done putting silicone in your face, because she was at his doorstep literally every day for more silicone. So he said, well, you know what you could do, you could just get some vegetable oil, cooking oil, and put a little bit in a syringe and start injecting, you know, your own face to plump up your cheeks or your lips. It's not like when we inject collagen or hyaluronic acid. These are natural fillers that our skin naturally produces. Something like this, you get in the body, it's a foreign body. It forms what you call granulomas, or these areas of inflammation. It's impossible to remove that.
They tried to do an operation to remove some of this cooking oil. It basically shows that no matter what you try, it's still going to be disfigured. And the moral of the story is you should never be taking syringes home and injecting yourself with anything.
Right.
And
if any, exactly.
And here in this country, doctors, those of us who do elective, you know, body altering surgery, a big part of our training is understanding the psychology of why people are doing things. And we're tested on this, and if we recognize that somebody has this, we say no.
Let's talk about something more lighthearted.
Okay.
Yeah.
Who likes tomatoes?
Yeah.
Not bad. A lot of promising research lately into tomatoes. They're talking about a purple tomato as a possible cure for cancer. What they're doing is they're genetically modifying them to make them purple. They're high in anthocyanin, rich antioxidant that may be able to help stave off cancer.
Yeah, that's the chemical in a lot of veggies and fruits that give it that rich, deep color. And it's so, so good for you.
And that's why we always say colorful vegetables are better for you because they typically are richer in antioxidants, which stave off aging, cancer cell growth, amongst other things. But a lot of people will say, is this the right way to go about it? We're genetically modifying.
Basically crossbreeding, the snapdragon flower, which is rich in anthocyanin and tomatoes. So it's not they're not like tampering with the DNA.
Tomato.
It's just kind of
But I think they're heading in the right direction. They're looking for other ideas. We're not making enough ground against cancer. Let's look at all the possibilities.
Yeah, I mean, you're going to have to, create things to battle cancer, because cancer is an abnormal growth. So you're going to have to, really go out there and create things. Anything that's going to help battle cancer, I think, is a plus.
Prevent it.
Or prevent it.
Exactly. That's what would be even better.
Yeah, and huge cancer prevention, decreased diabetes, a lot of the age-related degenerative diseases, a lot of that stuff.
Eat your tomatoes, okay?
Fruits and veggies.
Now, Lisa, I know you're demonstrating a test today that all women need to be aware of.
Yeah, absolutely. It's called a colposcopy, and basically it's a follow-up to a pap smear. And anytime a woman has an abnormal pap smear, you do this procedure because basically cervical cancer can be cured. It can be, it can be prevented, and it can be cured with these early screening tests like pap smears. Now, a colposcopy is basically used to identify the abnormal areas and then to remove those areas, so it's a diagnosis and a treatment all in one. So it's a really great tool. So the cervix, and this is a little model here, is at the back of the vagina, okay? And basically your cervix looks like a bagel, okay? So if you looked in through the vagina, which is what you can do with this colposcope, then you can actually see the cervix. You can see the abnormal cells and take a biopsy of them. So it's a procedure that can be potentially life-saving. It's just something, every woman should have if they have an abnormal pap smear. We actually have algorithms of when we should do colposcopies as gynecologists. And now being able to test for HPV has been made a breakthrough. So now if you're actually HPV positive and have an abnormal pap smear, then you go straight to this next procedure. Basically, again, this is the cervix, and what happens, that was a normal cervix, and this is what an abnormal cervix can look like. A lot of times inflamed, irregularly prominent blood vessels, and basically if you put vinegar on that, that's gonna show up, really strikingly, and you'll be able to define the borders and take the abnormal area and get it diagnosed.
And you're gonna do that right here.
Right here.
In the procedure room.
Right. Right here, live.
Hey, Drew.
On the dock.
I'm not volunteering.
Lisa's going to go ahead and perform a real-time colposcopy in our show, in our procedure room today. But first, I want to tell you more about Amanda, who we talked about before. Obese for her entire life until she decided to take some drastic measures.
I was kind of like a normal-sized kid until about 4 or 5. Just started gaining weight. I was put on my first diet when I was 7, and I was diagnosed with hypothyroid when I was 11. Every day that I went to school, someone called me some name. I've been called fat, fat bitch, fat ass. Never stopped dieting, never lost more than 5 or 10 pounds. In 2000, I practically killed myself with diet pills. My weight was spiraling out of control up to the highest weight I had, which was 360 pounds. There was one day when I was walking to the corner and I couldn't make it. Everything hurt. It finally hit me. Oh my God, this could kill me. I went back to my apartment and I made an appointment to talk about gastric bypass. It's been about 2.5 years and I now weigh 180 pounds. It was literally like deflating. I still have all of this loose skin. I can just pull this away from my body. None of this is fat. It is all skin. I always say when I look in the mirror, it's a complete toss-up between Shar Pei and Melting Candle. I won't even keep a full-length mirror anymore. It's such a jumble of emotions to think about having a total body lift. To know that I'm putting my life in the hands of this team of 5 doctors. I'm like shedding a skin suit. Finally, people are gonna see what I am and who I am, because there's nothing left to make fun of.
Coming up, we'll take you inside Amanda's total body lift and show you how 5 surgeons worked tirelessly to fix her stomach, her back, her butt, her thighs, and her breasts, all in one surgery.
After a lot of weight loss, the body shrinks down, but the skin does not retract back to where it should be. Total body contouring surgery removes excess sagging skin. Amanda's a case where this is very much needed surgery. She's very self-conscious about this, so all this is very good.
Sounds good.
Sleep well.
Thank you.
And later,
She started out tipping the scales at nearly 400 pounds. Now it's been 3 weeks since her surgery. I don't know about all of you, but I can't wait to see the new Amanda. Amanda, come on out.
The following program contains adult material. Viewer discretion is advised.
I just get into this vicious cycle of feeling like I'm a failure, but you can't make size 32 skin into size 8 skin. I am ridiculously excited. I'm finally gonna be this person on the outside that I really feel like I am on the inside.
If you're like most people, you'd probably like to lose a few pounds, but anyone who's lost a lot of weight knows you'd be left with stretch marks or worse, sagging skin. There is a procedure, it's called the total body lift, that can reshape your entire body in one surgery. We scrubbed in with Dr. Ordon and his colleagues to check it out. I want to warn you, some of what you may see is very graphic. It's not appropriate for small children.
Nobody else on the planet is doing what we're doing today.
Total body contouring removes excess skin. Hold your little fold of skin here. We spend the better part of an hour marking the patient out so that we can get a roadmap as to how much is going to be removed.
I've assembled the dream team of plastic surgery today, headed by Dr. Hurwitz, Dr. Calvert, Dr. Brenner, Dr. Chopra. This is about 100 years of experience, 5 board-certified plastic surgeons. And pre-planning is so important. This way we can all fit in without stepping all over each other.
9 o'clock, we're starting the total body lift here. Let's do it to it. All right, come on, team.
We're only like 10 minutes into the case.
Dr. Calvert's gonna give her a new buttock crease.
Nice and thin in her waist. Everybody likes that. All right.
And if they're not too tired, they may do it on me later today. We've already excised her excess tissue, starting to close these up.
We've now flipped her. We're gonna do that breast reconstruction. That's the game plan. Are we ready?
We're ready.
We're tightening up her abdomen with some stitches.
We pulled that skin down and sewed it into place.
We're going to make an opening here and attach that down and make a new belly button.
We're now on the breasts.
This is the implant we're going to use. It's about 12 ounces.
We'll be done in 15. I think, Dennis, right?
15 minutes is right.
Wow.
Dr. Ordon, just right.
That finish line is in sight. We see it. It's that last, suck it up, guys. 7 hours. Dennis, that's excellent.
Thank you.
Close to 15 pounds of tissue was removed. We completely gave her a new body.
We're here with Dr. Ordon's colleague, Dr. Dennis Hurwitz. He's the creator of the Total Body Lift, and he's also author of the book by the same name. Welcome.
Welcome, Dennis.
Obviously a need for this surgery, and so you decided to create it.
You know, Travis, about 10 years ago, minimally invasive gastric bypass surgery became reality. We saw Amandas all over the place, miserable. They're healthier, much healthier, and happier about that, but you saw the problem with the skin. At the time, I tried out what plastic surgeons do. As individuals, we shape the breast, raise the breast, then come back later, cut off the tummy, did a tummy tuck, shape the thighs, maybe 6 months later, came back the arms.
So you're doing it piecemeal.
Exactly. So about 8 years ago, I decided there had to be a better way. Thinking about teamwork, that is, you have one surgeon in charge and experienced surgeons, not just interns, but experienced surgeons working with you and get it done properly and safely. And we're able to accomplish that. I think it's a revolution in plastic surgery.
Exactly.
And you're doing how many body parts at once?
We did 5 body parts at once, and the point that Dennis is making is that she was able to do it in one operation. We kept the surgical time down, only 1 anesthesia, only 1 recovery, and allow her to get on with her life. We put our team from the Roxbury Clinic, Dr. Brenner, who's here in the audience with us today. Dr. Calvert, Dr. Chopra, they're back holding down the fort today. They couldn't be with us, but they were a big part of the team.
And walk everyone at home through what's going on in this procedure.
Sure. Yeah, we're seeing her back view when segments of skin are being removed along the bra line and along the hips. The breasts are being exposed for the implants and shaped, and then, yeah, there right. She looks that good.
The planning was so key. If you want to turn your torso around.
Yeah.
And we started her on her tummy.
So the drawing was done. It took an hour and a half ahead of time. And as you can see along the bra line, rather symmetrically remove skin and fat and then close it up. In the waist area, liposuction narrowed her waist. In the hip area, we pulled up the thighs and raised the buttock by excising along these red lines. And then the butt crease and the under thighs were raised along the green lines. Then we turned her around on the operating room, and the keystone of the operation is the abdomen. So we would take a continuation of the hip excision and come across the belly button to the opposite side, cut out the belly button, leave it there, and when we pull down the upper skin, that would come through like a buttonhole and make a new cute belly button. Then we'll take the skin excision across the groin, across the pubic area, and into the other side of our hip, and all this skin will be removed, and the upper skin will come down. Meanwhile, while Dr. Calvert and Dr. Brennan were on that, I was working on the breasts and raising up her nipples. They were too low. They had to come up to a higher spot. Through this opening, where we removed some skin, we put those silicone implants, and on the side, we cut out some more skin and raised up the upper body. So it's upper body lift, mid-body lift, and then finally, we had to give Dr. Orden something to do.
I couldn't be a wallflower.
He's never a wallflower, but he kept talking so much, we had to keep him busy. So in this area of the thigh...
I'm the thigh man.
That's no question about it. In the area of the thigh, we took out skin down halfway to her knee, up around the pubic area, and closed that. So now she has tight thighs. And that's the operation.
And now it makes sense why it takes 8 hours and 5 surgeons to do all of that. Right. So, Drew, the candidates for this, or Dr. Hurwitz, they have to be someone who's obviously lost a lot of weight, has a lot of excess skin, because this is a huge operation.
There's no question
To go through.
But for total body lift, if you want to do it in 1 or 2 stages, they have to be young. And frankly, under 50 is just fine with me. They can no longer be overweight. They have to not only be healthy, but really fit, like Amanda was in marathons before the surgery. And finally, they really have to be motivated. They really have to want to do this. That doing this in 1 stage makes a big difference, and they're willing to accept the risks of surgery, which may be greater, so they can have 1 recovery and get back to their lives.
Big time surgery, but a lot with the recovery. All of these areas had to be drained. We placed drains in each one of these areas that we treated. Very important, these stay in for at least a week. You can imagine all these huge raw surface areas have to be drained, and there's unique healing problems. You have so much surgical incision area.
If we don't take proper care with bandages, with elastic support, drains, we're going to have trouble with healing, and that could be a monstrous problem. But getting to the cost of this surgery, having all these surgeons involved, all this expertise, in a rather unique operation, it runs around $50,000, frankly. It could be a little less, it could be quite a bit more, depending on what needs to be done. But it's a real 2 to 4 that we really go through. And
insurance sometimes may help.
They'll help in part of the costs, yes.
And there are very special dressings we have to put on people afterwards for compression. I'm going to use you as the other dummy here. You're going to have to wear this for a few months to help your skin contract down. And we actually have those type of garments that we put on the breast, the back, the abdomen, and the thighs.
We have to be very careful with these garments. They're not too tight, not too loose. It takes a lot of care afterwards, watching their vital signs, their blood, urine output, pain management. It's quite involved, the whole process.
Well, coming up after weeks of being in pain, confined to rest and home care, it's time to see Amanda's new body coming up next.
So it was really, really hard. First couple of days, I mean, even now I'm feeling really groggy, a lot of pain, really tired, but I'm doing better. I'm really glad I'm on this side of it, and I can just concentrate on healing. It's day 6 for my surgery. Doctors say I'm doing well. They've taken out 2 drains. I'm still in a lot of pain. I have to have pain medication around the clock. Everything hurts. I can't take a shower. I can't wash myself. I need help going to the bathroom.
So Amanda recently had an extreme plastic surgery. It's called the total body lift. Her transformation has been years in the making. She started out tipping the scales at nearly 400 pounds. Then she had gastric bypass, lost 180 pounds, but was left with a lot of extra sagging skin. Now it's been 3 weeks since her surgery. She's here today to show us her new body. I don't know about all of you, but I can't wait to see the new Amanda. I wanted to take one last look at what she looked like before. Are you all ready?
Yeah.
Amanda, come on out. How do you feel?
Amazing.
We're going to put this in perspective.
Those were tight when I wore them. So we can pull it even tighter.
You look fantastic, and watching your clip 6 days out, the last 2 weeks have done good things for you because you're smiling now.
Well, the funny thing is the first week, the first 2 weeks after the surgery, I would never believe that 3 weeks after the surgery, I could sit here, I could wear this, that I could talk to you and like have a decent conversation.
I mean, 3 weeks is nothing. And she's still a work in progress, right, Dennis?
There's no question about it. I understand you went down from a 16
to a 12.
To a 12, and you're going to be at an 8.
Yeah, that's the part I'm really excited about.
Wow.